Librela is a once-monthly injection used by veterinarians to control pain associated with osteoarthritis in dogs. Its active ingredient, betinvetmab, targets nerve growth factor, helping reduce pain signals linked to osteoarthritis. The recommended dose is 0.23 milligrams per pound, or 0.5 milligrams per kilogram, once every month. Dogs under 11 pounds need a carefully measured dose from the 5 milligram per milliliter vial. Dogs weighing 11 pounds or more generally receive the full 1 milliliter vial, selected for their weight range. Dogs over 132 pounds may require a combination of 2 appropriate vials to achieve the recommended dose. Librela is injected under the skin once monthly and should only be administered by or under veterinary supervision. Possible side effects include injection site reactions, urinary infections, skin infections, vomiting, increased thirst, and urination. Rare post-approval reports include weakness, tremors, seizures, balance problems, and other serious neurological signs. Always weigh your dog accurately. Follow the prescribed schedule, and contact your veterinarian about any unusual symptoms. For a dosage calculator, detailed benefits, potential side effects, which dogs should avoid this medicine, and safe serving ideas, visit our website through the link in the description.